Hello, my name is Andrea Richards, and this is my final project for GPH 732. The population that I researched were people utilizing the emergency room at Franklin Memorial Hospital in Franklin County, Maine. Franklin County spans over 1,700 square miles and includes over 20 towns and plantations. There are many farmlands, medical services, shopping areas, housing developments, low-income housing areas, and other community resources. Transportation is very limited, and there are only a few public transportation options available. And Franklin Memorial Hospital is a general medical and surgical hospital located in Farmington, Maine. The population of Franklin County is around 30,000 people. 15% of the families living in this county are living in poverty, which is about 20% of all of our children living in poverty in Franklin County. The median household annual income is $41,626, and the unemployment rate is 6.6%. More than 11% of the community residents do not have health insurance per 2013 data, and 12.8% experience cost-related barriers to accessing healthcare. Farmington is one of the biggest towns within the county. Franklin County and Farmington are not very racially diverse, with over 97% of the population being white. 38% of the over 3,000 families are married couples, and almost 50% of the homes were non-families. The median age of people living in Farmington is 32.1 per the 2010 census. Franklin County is a beautiful area rich with agriculture. The county consists of 5 school districts and is home to the University of Maine at Farmington. There are multiple local parks and recreation areas for families, as well as mountains to explore. For this research, the precede-proceed logic model was used. The first part of the model, precede, has 4 phases and is the section that was used for this research. Phase 1 of this logic model is about identifying what the community's wants and needs are, which will help define the community health assessment outcomes. Phase 2 looks at the factors or issues that could be causing or affecting the outcome defined in phase 1. The third phase is where the factors that will lead to the behavior or the environmental change are identified. And the fourth phase is where best practices and other intervention opportunities are viewed and chosen based on how they'll impact the intervention. The proceed part of the model is where the implementation happens and the process, impact, and outcome evaluation takes place. Again, this research looked at phases 1 through 4. This model was used because community participation is key to the success of this logic model and this research. This model starts with determining the desired outcomes and works backwards towards a solution. And this model is easy to be tailored to the needs of our community through the flowchart process. Other methods used for this research include windshield surveys, interviews, and secondary qualitative and quantitative data. Through the data research, it was found that people are overutilizing the emergency department for issues that included chronic pain, substance use, anxiety, and reproductive issues. Reasons found for why people are using these services include convenience of not having to set up a medical appointment with a primary care physician, not having a primary care physician, cost-related barriers such as no insurance or being underinsured, and no transportation. And that can include not having a vehicle to get to the medical office or having a family that maybe only has one vehicle shared between two adults. And the convenience of utilizing the emergency room after hours is easier than trying to find a ride in this rural community. Some key health indicators of Franklin County, as we talk about the reasons why people are using the emergency department, over 11.6% of the residents in Franklin County are uninsured, and 13% rated their health from fair to poor. Many people are not set up with primary care, and the ratio of residents to primary care is 800 to 1 in Franklin County. The ratio of residents to mental health providers is 400 to 1, which is different from Maine's ratio of 250 to 1. Overall, according to the county health rankings, Franklin County is rated 8 for health factors out of the 16 counties. For quality of life factors, Franklin County is ranked 12. As I mentioned, 13% of people rated their health from poor to fair. Poor physical health days, 3.6 people, or 3.6 versus Maine's 3.7, and poor mental health days, 3.9 compared to Maine's 4. So through this research, mental health was identified as a top health issue by the community. Mental health risk factors include low income, substance use, anxiety, smoking, and high stress. All of these issues are being seen with the patient seeking emergency room care for mental health issues. The Maine Shared Community Health Needs Assessment, completed in 2015, reported that 22.5% of adults in Franklin County have ever had depression. The mental health emergency department rate per 100,000 people was 1,568.5 versus Maine's 1,972.1. This data came from 2011, and the difference in those rates were statistically significant between the county and the state. In summary, mental health was found to be affecting many of the people visiting the emergency room in Franklin County, Maine. Poverty rates are key indicators to health, and the stress that comes along with this health factor plays a part in the use of the emergency department for mental health care. As you can see, the poverty levels of Franklin County, Maine exceed the state of Maine. The annual income is much lower, and a greater difference is seen between the United States annual income and Franklin County. In conclusion, mental health is affecting our vulnerable populations and causing repeat visits to the emergency department, where other mental health or primary care visits could intervene. The access to resources for mental health through the emergency room is very limited, and there are only a few mental health resources available within the community. This proves difficult in working on a solution, as this area is affected by many barriers mentioned earlier, such as transportation, no primary care, not having insurance, being underinsured, or having low income or living in poverty. The next steps of this research are to expand further into the community, to gain more thoughts and opinions on what people view as being barriers to accessing mental health care or reasons utilizing the emergency room for mental health care. It's important to involve the community as a whole more in those conversations and to find other ways to install prevention efforts or to increase the efforts going on in the community. Thank you.